from doing detoxification methods on these kids, either topically, orally, or the best way is IV, to help bind the toxins for appropriate excretion. So to chelate, to grab onto and remove, just like this bird is finding what is it attracted to and pulling it out of the body. I've been using chelation therapy since 1994 in my practice, along with osteopathy and hyperbaric and other holistic approaches. I'm a DO who actually does spinal adjustments and then trained as allopathic medicine, and osteopathic medicine is so similar, but we can get to use a little more holistic approach, which is probably why I got involved with it and learning about these different topics. Many of my heart patients, cardiovascular patients, have been able to avoid or delay coronary artery bypass stents, or stents, with great reduction of blood pressure in diabetes problems, erectile dysfunction problems. If you improve circulation, you will end up having a better quality of life. And if you can reduce the oxidative stress by reducing and removing these free radical generators, then less inflammation will occur. I've had diabetics get off of insulin by chelating them. There was a great study that came out, a double-blind placebo-controlled study in November 2012 with 1,700 patients. Some did chelation therapy, some did not do chelation therapy. So they were randomized, double-blinded, just like doctors like. It showed they were all the same. They all had a heart attack in the past. They were on aspirin, a beta blocker, and a statin, traditional therapy we do in the States for everybody with a heart attack. And they showed a 38% reduction in acute myocardial infarction recurrence, stent, hospitalization, death, or stroke, 5 parameters. They showed a 38% reduction in people who've had acute MIs in the past from an anterior wall, a 37% reduction in diabetics for hospital admissions of those 5 parameters, and 18% reduction in everybody who had a heart attack in the past when you detoxify them and remove the metals out of the system. That's in the cardiovascular world. In the autism world, as I mentioned before, Dan, the Defeat Autism Now, had this study, this ARI study, that showed what therapies worked for my child, what therapies did not. The number one responding therapy has been chelation therapy for years, with between 73 and 75% of the parents saying, my child improved with this therapy. And I find this to be something I do after I fix their terrain. But I have to get them balanced first. There's various forms that we use. TMSA is the easiest for a small child because they don't do well with IVs. But the best thing is calcium disodium EDTA or calcium EDTA. Calcium EDTA we use more for the cardiovascular patient. Calcium EDTA is a true heavy metal